Welcome, and thank you for attending today's Healthcare IT News webinar, Connected Medical Devices, How Well Are They Secured? Sponsored by ZingBox. My name is Bill Sawicki, Managing Editor of Healthcare IT News, and I will serve as moderator today. We look forward to your questions and comments, which you can submit at any time by accessing the question box on your screen. We will make every effort to answer as many of your questions during the presentation's live Q&A. Connected medical devices present a challenging problem for security professionals in healthcare organizations. Such devices are typically not well protected and are now under near constant cyber attacks. This webinar, presented by Mayuresh Ektare, Vice President of Product Management at ZingBox, will reveal the challenges in securing medical endpoints and discuss the steps security professionals can take to avoid being victims of cyber threats and significantly reduce their risk exposure. Our speaker for today's webinar is Mayuresh Ektare. He is the Vice President of Product Management at ZingBox. I now hand things over to him.
Thank you, Bill, and thank you everyone for taking the time this morning to join the webinar. Connected medical device is actually one of my favorite topics. Here at ZingBox, we come across many IoT devices, Internet of Things. However, connected medical devices really represents the core challenge that hospitals typically face. It will be my pleasure to walk you through the entire solution as well as the challenges many of our customers face today. So over the past several decades, the biomedical or the clinical engineering teams and the information technology teams have been two completely independent domains. However, over the past several years, we have seen an increasing number of medical devices rapidly getting connected onto the network. As these devices join the network, hospitals and healthcare delivery organizations definitely reap the benefits of operational efficiency, but the same security risks that have plagued the IT environments for such a long time also suddenly start affecting the biomedical or the clinical engineering teams as well. Unfortunate fact is that the hospitals are really not prepared in terms of their people, the processes, or even the technology services that they have on the biomedical engineering side to protect these medical devices from the cyber attacks or even insider threats. Healthcare is it's getting connected at a rapid pace. We see medical IoT devices like the infusion pumps, MRI scanners, patient monitoring systems, X-ray machines, and many others rapidly joining the network. On the other hand, we also see operational Internet of Things, which are essentially the connected HVAC systems, smart lighting, surveillance cameras, synchronized clocks in a hospital. These devices are also getting connected onto the same network. Essentially, what is happening is a real-time health system is being created and invented at hospitals. As these devices are connected onto the same network, what we really see is that hospitals are becoming really important targets for cyber attackers. In fact, recent reports have suggested that 90% of hospitals have been victims of cyber threats. Now that's a staggering number to think about for an industry. Gartner has predicted that about 25% of identified attacks in healthcare organizations will involve some sort of IoT device, Internet of Things device. And these devices could be medical endpoints or the building automation systems like we discussed earlier here. In fact, there is an interesting challenge that is being posed by the connectivity of such non-traditional, unmanaged medical devices and other IoT devices on the network. It is not just about security for these connected medical devices, but in fact it is around the safety of the patients to whom the care is actually being delivered. The quality of care and the security of the data as well as the equipment is of utmost importance here. I would actually like to do a very quick poll here. You might be able to see a quick poll question on your screen. If you will help me answer this question quickly, we will be able to share the results during our webinar today. I'll just give you another 10 seconds to answer this question. It's a very short poll. Five more seconds for this question. Perfect. Let's move on. So as we discussed, healthcare really has been the most attacked industry recently. In fact, 90% of hospitals have claimed to be victims of cyber threats. That's really a staggering number for any industry. In fact, healthcare has ranked higher than the financial sector in terms of the number of attacks that they have experienced. Each hospital typically experiences about 2 to 3 attacks on a monthly basis. Now, that's a great deal of effort that hospitals typically have to engage in to secure their networks. Enough emphasis has been given to protecting the IT assets on the network. However, the IoT assets typically remain unsecured, yet connected onto the network. When we speak with hospitals, many of their CISOs, Chief Information Security Officers, are really concerned about the security of these connected medical devices. A recent survey identified about 77% of hospitals being really concerned about the security for their connected medical devices. And yet, very few have tools or strategies in place to secure these devices. In fact, only 27% had thought about some strategies to secure these medical devices. To make things worse, we also see a very recent SANS report that has identified 17% of confirmed attacks inside a hospital actually originate from these connected medical endpoints, which are left completely unsecured on the network. In fact, 75% of the traffic through the medical devices is generated by these medical devices is completely unmonitored. Now, this creates a tremendous challenge in protecting these devices on the network. Let's look at the poll results here. And it is really interesting how we see the 39% of respondents here do not have any inventory management systems to manage their connected medical assets. In fact, if you really think about it, 20% are still using Microsoft Excel to manage their inventory of connected medical devices. That pretty much brings us to close to 60% of respondents here who do not have sophisticated systems for managing the connected medical devices. Draw an analogy of how IT assets are managed inside a hospital now. Every single laptop, every single cell phone, tablet in your IT environment is managed through effective tools today. And yet, the connected medical devices or the Internet of Things that are connected onto the same network have no manageability around them. In fact, IT departments do not even have enough visibility into the existence of these devices. If you ask the IT teams inside the hospital to identify how many connected medical devices do they have on their network, they wouldn't be able to tell you the precise number. And the reason is because they don't have the tools to actually manage these devices effectively. I'm glad to see this number actually, if you are able to see the poll results for the second question. Many respondents have some solutions in place to monitor connected medical devices. Today we are also going to see what can we do to boost our security posture in protecting these medical devices. All right, so let's get into the details here. Connected medical devices have become an ideal target for cyber attacks. In fact, they are really the weakest links on the network. The fact that you don't have endpoint security agents like Norton Antivirus or McAfee running on your medical devices, they really become the weakest links on the network. Unprotected and oftentimes unpatched due to the heavily regulated industry as medical devices are part of. Majority of the times, the IT security teams have no visibility into the inventory of these connected medical assets on the network. Time and again, we have seen enough media articles about how medical devices are really getting hacked into. Medical devices are vulnerable. Oftentimes, they are using off-the-shelf operating systems that expose common vulnerabilities, known vulnerabilities onto the network. These vulnerabilities can very easily be exploited by off-the-shelf malware, and hackers can actually get access into the network. Many a times hackers do not target, at least at the moment, they are not targeting medical devices directly, but they find these assets, medical devices, as easy targets that they can get into with low effort. In fact, medical records are 20 times more expensive on the black market compared with a credit card number. Now that gives hackers a financial motivation to target healthcare industry over any other industry out there, which has resulted in healthcare becoming the #1 target for cyber threats. Stolen data from healthcare systems also has a longer shelf life. Credit cards or financial systems have put effective security measures in place wherein they are able to manage the risk around theft of digital data. However, the stolen medical records have a longer shelf life, and hackers are able to leverage this stolen data for about a year and a half, if not longer. Also, what we see rapidly happening is separation of the skill and the intent of cyber attacks. Hackers now have figured out easy ways of getting into the network. People who are actually launching these attacks are not necessarily the ones who want to attack the organizations. Many a times, the hackers are actually being outsourced by someone else. This separation of skill and intent has increased the frequency of attacks that we all experience today. Let's go into understanding security posture for these connected medical devices. Now, as we discussed earlier, we really can't have endpoint security solutions running on connected medical assets. IV pumps, patient monitors, radiology equipment, X-ray machines, CT scanners. We simply can't deploy endpoint security agent on these devices. And without the endpoint security agent on these devices, what happens is the firewall suddenly becomes your single line of defense. If you compare the security around medical devices with your traditional IT infrastructure, what is most apparent is the availability of a tiered security model that is at play in IT environments. In the IT environments, we always have an endpoint security solution, and we pair it with a network security solution like a firewall or IDS IPS solution. We also deploy several intermediate solutions for network security, like vulnerability assessment tools and many others. Now compare it with the medical IT network. We are missing endpoint security solution, and firewall is now the single line of defense. Unfortunate fact is that the firewall typically works at the IP layer. They understand the IP addresses of every single device on the network. However, what they don't understand is the context of these devices. while the firewall knows the IP address of these devices, they don't know what type of device might be really connected behind that IP address. Whether that a device is a surveillance camera or an IV pump or an X-ray machine in a hospital. Now, depending on what type of device is sitting behind that IP address, the policies that need to be applied at the firewall should differ a lot. Now, security administrators who are managing these firewalls today are at a loss because they have no visibility into the context of these devices. Typically, firewall rules are generated using IP addresses and IP ranges, which really make it practically impossible for security administrators to protect a medical device network. As you can see, as a result, majority of the traffic in the medical device environment remains unmonitored and unprotected. Even with traditional IT security tools being deployed in the medical device networks, those tools are still unable to secure these devices because they do not have the context of these devices. Any network monitoring tool that is designed for protecting the IT environments could essentially be deployed in securing the medical IT devices as well. However, their accuracy on detecting these medical assets and securing them, does not actually work effectively in this environment. So let me propose a few additional insights into how devices and networks are secured today. Today's IT environment is extremely homogeneous in nature. The IT environment today consists of laptops, servers, desktops, PCs, smartphones, tablets. In fact, when you look across the entire IT infrastructure, we are able to count the number of operating systems on our fingers. What it really is suggesting is that the entire IT infrastructure is extremely homogeneous today. The underlying assumption here that security vendors are making to secure the traditional IT infrastructure is that a malware in this environment is going to be portable. A malware that could infect my laptop today could also very well infect any of your laptops. Now, given this portability of the malware, every single security vendor out there today has leveraged a reactive way of securing devices. What security vendors today do is they get hold of the malware and they analyze the behavior of the malware to describe the behavior in either heuristic rules or traditional signatures. They analyze the behavior of the attacks, the payload analysis. What we see here is the common thread across the IT environments is the behavior of the malware, which can very accurately be described in signatures or heuristic rules, so that the next time you encounter the same malware again, you are going to be able to identify, detect, and secure the networks. Now, this approach has worked for the past 2 decades in the IT environments, primarily for one reason, because the infrastructure is homogeneous. You only have a few platforms, a few operating systems at play, which makes this particular model feasible in the IT environments. Now, step into the network of the future, and the network of the future looks a lot diverse than what we have seen in the past. The network of the future consists of devices that are really diverse in nature. They support a variety of operating systems, platforms, form factors, and the underlying assumptions that the security vendors were making that the malware is going to be portable remains broken in this environment. The malware that might infect an IV pump would look a lot different than the one that might infect an X-ray machine or an MRI scanner. Now, in this scenario, what good does it really do to analyze the behavior of a malware and describe the behavior of a malware in heuristic rules or signatures? Such approach does not work, neither can it scale to secure the connected medical devices and other Internet of Things. This reactive approach completely fails to protect IoT devices, neither can it scale. What we propose is a completely different model, wherein the common thread in IoT is not the malware anymore. The common thread in IoT is the device personality. Now let me elaborate a little bit on what device personality really is. If we think about an X-ray machine in a hospital, regardless of which hospital that X-ray machine is deployed in, all X-ray machines share some common behaviors. Unlike the IT general purpose IT infrastructure, each laptop has a different behavior of its own. Each server has a different behavior. However, from an X-ray machine standpoint or an IV pump standpoint, these devices, or any IoT device for that matter, is a purpose-built system. These devices are designed to perform only a few things, very repetitive basis, thereby exhibiting an extremely predictable behavior on the network. We propose a solution that takes advantage of this fact. It takes advantage of this predictive behavior of these devices on the network and builds out a complete profile of these devices' normal activities on the network. A solution that works in IoT is a machine learning based approach that automatically recognizes the behavior of these devices and builds a baseline of these devices' normal activities on the network. What is important to notice here is the fact that in the IT environments, we have the malware behavior as the common thread on which all security solutions today are based off. In the IoT environments, the IoT personality, the behaviors of the IoT now become the common thread, which has to be harnessed to protect these devices. The focus has to be completely shifted from malware-centric approach to a IoT device-centric approach or a connected medical device-centric approach. That is the only way to secure these connected medical assets today without having any endpoint agents deployed on them. Now, let's take a deeper look into what kind of personality these IoT devices or the connected medical devices really exhibit on the network. The context of these devices are really important in terms of securing them. Without knowing whether a device sitting behind an IP address is a surveillance camera or an X-ray machine in a hospital, it becomes really hard for security administrators to define any meaningful policies to protect these devices. Context is at the core of securing these devices. A machine learning algorithm automatically recognizes and identifies what type of devices are on the network and builds out a complete inventory of connected medical assets on the network. A profile of every device consists of 3 layers. The first one is around the device type. Let's elaborate that a little bit. Let's take an example of an X-ray machine. An X-ray machine, regardless of who the vendor is, what the model is, it could be, as for an example, a GE X-ray machine, a Philips X-ray machine, a Siemens, what have you. All X-ray machines do share some common behaviors on the network. Those behaviors can be compiled as the tier 1 of the profile that the device exhibits on the network. The second tier is essentially a vendor model information. A GE X-ray machine, let's take a model DR6000, exhibits certain behaviors, common behaviors, on the network, regardless of where they are deployed. Whether it could be deployed in hospital A or hospital B, it really doesn't matter, because IoT devices are purpose-built systems designed to perform few things on a very repetitive basis. Those behaviors that are common to a certain vendor model can be grouped as a tier 2 behavior model. And finally, the third tier consists of the behaviors that are exhibited by a single instance of an X-ray machine that is deployed at a given hospital, because it could be configured differently. It could be speaking with different systems. It could be speaking with a different PAC server for archiving those X-ray scans. It could be speaking with EHR platforms in case. those behaviors are compiled in tier 3. When you put all these 3 tiers together, you get a complete holistic profile for a given device on the network. Now, to generate these profiles, holistic profiles for a device, manual approach absolutely doesn't work. Manual approach that has been used for securing IT assets today by analyzing the malware absolutely doesn't work. Signature-based technologies are not going to work in securing these devices today. A deep learning solution that is based leveraging the machine learning algorithms, not just to build out the profile, but also to recognize these devices is really important. By recognizing these devices and classifying them into different categories, as in IV pumps, X-ray machines, CT scanners, blood gas analyzers, we are able to create different profiles for different class of devices. Create these 3-tier model for building out a comprehensive personality of every device on the network. A deep learning algorithm today can secure these connected medical devices, and that has to go beyond the OS recognition. Let's elaborate that a little bit. Many a times, connected medical devices use an off-the-shelf operating system for powering the devices. For example, some X-ray machines actually are powered by Windows operating system. From a network security, if a traditional IT network security solution was deployed to protect these devices, a traditional IT security solution would detect an X-ray machine as a Windows computer, as a Windows operating system. Now, traditional security solutions often detect these devices using their DHCP fingerprints on the network. And likely they are going to identify this device, X-ray machine, as a Windows computer. That does not actually provide enough context to the security administrators to secure these devices. So the recognition of these devices has to go beyond the operating system recognition. Machine learning algorithms today are well positioned to extract small pieces of information from every session, every packet that is being generated by these connected medical assets. Machine learning algorithms are able to extract small piece of information through these sessions, through these packets, and connect the dots together, stitch all of these small nuggets of information to build out that holistic context by understanding which applications, which protocols are being used by these devices. Just to give you an example, an X-ray machine typically uses DICOM as a protocol for communicating with a PAC server to send over the X-ray scans. Now, though it is a Windows-powered machine, it uses specialized protocols and thereby exhibits certain personality on the network. Traditional IT security solutions will not be able to identify this personality and identify this device as an X-ray machine. However, advanced machine learning algorithms are able to classify this device not just as a Windows machine, but actually identify it as an X-ray machine and apply the tier 1, tier 2 policies to them so that even before learning the behavior of that particular device on the network in a given hospital, machine learning algorithms will already be able to bring in a certain policy enforcement to protect these devices from suspicious attacks. Tighter controls are really needed to protect these medical devices. Unlike a general purpose computer, a Windows computer is allowed to do several things on the network. Take an example, my behavior on the network remains really erratic. Sometimes I'm using certain applications, sometimes I'm using different applications. And every activity on the network seems to be a normal activity. It's hard to create a baseline of users' activity on the network without generating too many false positives. However, with connected medical devices that are designed to perform only a few things on a repetitive basis, machine learning algorithms are really well positioned to build out the baseline of normal activities on the network. Since these devices exhibit an extremely repetitive behavior, machine learning algorithms can take advantage of this fact and really provide a comprehensive baseline for those devices and apply effective and tighter controls on the policy side without generating too many false positives. And finally, security from day one, meaning that when we think of machine learning algorithms, we always think about a learning period that has to be presented, meaning that the solution has to learn the normal behavior of that connected medical device over time and build out the history of its profile. Now, in this scenario, immediate question would be, what if the device has been infected to begin with? Would the machine learning algorithms actually learn this suspicious, malicious behavior and treat it as normal? The answer to that question actually is no, because by splitting the entire profile of a connected medical device into 3 tiers, what machine learning algorithms are able to do now is bring in the intelligence of tier 1 and tier 2 along with it during from the day 1 of deployment. The only thing that needs to be learned on premises in a new deployment is the tier 3, which is unique behavior of each X-ray machine at a certain hospital. By bringing the tier 1 and tier 2 together, machine learning algorithms are able to secure these connected medical assets from day 1 without learning the suspicious activities if the machine has been hacked to begin with. Healthcare IoT security or connected medical device security really has to begin with deep learning. When we speak with many hospitals, and the biggest problem hospitals and clinical engineering teams as well as the IT teams have is around the visibility of devices. Many hospitals call these devices as unmanaged assets on the network because there isn't a single pane of glass that allows the IT teams to actually manage these connected medical devices, detect them, recognize them, classify them, and build out an active inventory of these connected assets on the network. Visibility of these medical devices is the biggest challenge for any hospital today on the network. Building out the personality of these devices and doing a behavioral modeling is the second part of it, meaning that once you get visibility, hospitals really want a complete posture of the security on their devices. They are really looking forward to gaining enough additional insights and understanding the risk that is being exhibited by these devices on the network. What kind of vulnerabilities are being exposed on the network? A machine learning algorithm can actually create these behavioral models of how the device operates on the network, what kind of personality is it exhibiting on the network, and create that profile, a 3-tier profile, using the data that it can capture from every session, every packet generated by these medical assets. With this information in place, with the visibility, the context, and the behavior of these devices in place, hospitals are then able to regulate the behavior to only allow the trusted behavior of these devices. The trusted behavior, once it is captured through the profiling system, can be enforced through the whitelisting models. You can only allow the medical devices to exhibit certain set of communication patterns on the network once these behaviors are automatically learned by a machine learning algorithm. The knowledge base of the medical device profile is what really powers this entire system today. It's my pleasure to actually introduce ZingBox IoT Guardian, which essentially takes advantage of all the things that we have discussed up until now. ZingBox has introduced IoT Guardian as the first SaaS solution that is purpose-built to secure healthcare-specific IoT devices, meaning the connected medical devices. In fact, with today's hospitals, medical devices are not the only IoT devices we see. We also see building automation systems, HVAC controllers, surveillance cameras, security card readers. and many other assets, that unmanaged assets on the network that are being protected by ZingBox IoT Guardian. We employ self-learning algorithms to essentially deliver three things. Discovery, an automated way of discovering all the connected assets and building out an active inventory of connected medical devices and other unmanaged assets on the network. Visibility is essentially the foundation of trust. You need to know what type of devices are on your network to secure them. You really can't protect what you can't see, and ZingBox has a firm belief that visibility is really key to security. Upon generating a comprehensive active inventory of these connected medical devices, we are able to learn these trusted behaviors of the medical assets on the network. Learn the behaviors that are typically exhibited by X-ray machines, by CT scanners, by IV pumps, and create a profile, a 3-tier profile that we discussed earlier, to provide effective security controls from cyber as well as insider threats. By creating a baseline of a device's normal activities on the network, what ZingBox is able to do is detect any deviations from that baseline in a very precise and accurate form. Such systems allows us to identify the smallest deviation from an automatically learned baseline, and those deviations could be because of a cyber threat or insider threat, or simply because of a misconfiguration of the device. Regardless of what the root cause is for such deviation in the device's behavior on the network, ZingBox's deep learning, self-learning, machine learning based algorithm is automatically able to detect these devices, detect these risks. And finally, defend these devices using proactive real-time protection. ZingBox thinks about IoT devices and connected medical devices as a part of a hospital's care delivery system. It's not always about protecting the connected medical devices. What hospitals are really looking for is protecting the patients to whom the care is actually being delivered, protecting the service delivery inside a hospital so that the business continuity can be maintained. ZingBox has crafted a solution that proactively, in real time, secures these devices by enforcing the trusted behaviors that are learned during the profiling phase. To provide the security, the visibility detection as well as security, we think a non-disruptive model is most feasible. Hospitals, the medical devices in a hospital are mission critical devices. They are business critical devices, and hospitals rarely want those devices to be touched in any form or fashion. ZingBox actually proposes a completely non-disruptive deployment model wherein ZingBox solution connects to the network through a mirror port on a switch. Essentially, you can think about a solution that puts eyes and ears on the wire to analyze the traffic generated and terminating towards these connected medical devices on the network. A ZingBox solution that comes in two components. First one, which gets deployed on the premises, connects to the network through the mirror port on a switch. And the second component, the cloud, ZingBox Cloud, which applies the advanced deep learning algorithms to build out the profiles. The ZingBox hardware or the software virtual appliance analyzes the raw packets generated by these connected medical devices. These medical devices could be connected onto the network through either the wired channels or the wireless channels. Regardless of how these devices are connected, the data is eventually flowing through the IP network. ZingBox sits on the IP network, analyzing the traffic, analyzing the raw packets, and converting those raw packets into metadata. That metadata is then sent to the cloud. ZingBox never sends the raw packets to the cloud. What we do send to the cloud is the analysis of that payload. Once the analysis of the payload that does not contain any patient-specific information or personally identifiable information, ZingBox is then able to build out the profile by stitching all of these small nuggets of information using the machine learning algorithms. The profiles are being built in the cloud. The devices are being recognized and classified in the cloud. And ZingBox is able to provide real-time security through a cloud-based solution. An immediate question is, if ZingBox is an offline solution, how can it really take enforcement measures in real time? What ZingBox really does is it applies the machine learning algorithm in the cloud using a library of already known as well as newly detected medical device profiles. When we detect suspicious activities in the cloud, a trigger is then sent to the hardware or the software that is deployed on premises, which in turn instructs an existing networking equipment infrastructure inside a hospital to either have the devices quarantined or blocked in real time, should the administrators want to do that. To be honest, customers today only expect risk assessment and understanding the security posture, but would rather keep the enforcement piece manual so that they can evaluate the behavior of these devices and take the actions manually. I would like a moment to take this moment to share a use case. Recently, we were deployed at one of a large hospitals here in US, in Texas. In fact, the hospital had 500 beds and several surgery centers with over 5,000 connected medical devices on the network. ZingBox, after deploying, was able to identify, recognize, and build out the complete inventory of connected medical devices within a day. We were able to classify these devices into different groups, depending on what type of devices they were. X-ray machines, MRI scanners, CT scanners, IV pumps were all grouped into different categories based on their function, not just the vendor and model information. As an example, X-ray machines from Philips, GE were all grouped together as an X-ray machine. Because ZingBox applies machine learning algorithms, we are able to classify these devices based on their function. The hospital really enjoyed the visibility. Just like many of the respondents here today, the hospital really didn't have enough effective inventory management tools to manage their inventory of connected medical devices. ZingBox was able to create that single pane of glass and provide them with a complete inventory of medical assets deployed across multiple locations. By deploying ZingBox in each location, we were able to centralize that inventory management system and allow the clinical engineering as well as the IT teams to get complete visibility into their medical infrastructure. With the inventory management system in place, ZingBox was able to provide advanced risk assessment algorithms to really identify the security risks around these connected medical devices. To give you an example, X-ray machines typically use a DICOM protocol for communication. As soon as ZingBox detects different protocols being leveraged for communications, even internally, we are able to fire notifications, alarms, as well as raise the risk level on these devices. What the customer really enjoyed the most is the fact that we were able to monitor and analyze not just the northbound and southbound traffic, but also the internal traffic, the east-west traffic inside a hospital, and analyze it to create the complete behavior profile for that device. With the visibility and the risk assessment piece in place, we were able to provide service continuity and allowing the customer to manage the inventory of the integrity of these devices on the network. Since ZingBox is able to analyze every session, every packet on the network, what we were also able to do is provide assistance with HIPAA compliance. We know that medical device industry is heavily regulated, and starting this year, HIPAA has now extended its reach to also cover connected medical assets. Since connected medical assets oftentimes store really sensitive patient information, now ZingBox is able to provide assistance with HIPAA compliance for these connected medical devices because we are able to build out a complete audit trail around the changes in the behavior of these connected devices on the network. We are going to be at the HIMSS Cybersecurity Command Center this month, February 19th through 23rd in Orlando, Florida. If any of you would like to speak with us, get a feel of the ZingBox solution, or even learn more about how machine learning technologies can help you in understanding and evaluating the security posture of your connected medical device network today, please feel free to stop by and speak with us. I personally am going to be there. I would love to meet with each one of you in person. With this, I would like to pass it on to Bill for starting the Q&A session, please.
Okay, thank you very much for that very informative presentation. We do have time for a few questions from the audience, so let's begin. First of all, is there a limit to how many devices ZingBox can support? We have more than 500,000 medical devices.
Great question. No, so there is no limit to how many devices we can secure. I'm going to jump over to another slide right now, which will allow you to see the deployment model that will help me explain that question a little more. Now, a ZingBox solution comes in two components. The first one is the hardware or a software appliance that can be deployed on premises. Now, depending the topology of your network, you might be able to plant several of these devices in different parts of your network. Like I was mentioning earlier, it's almost like planting eyes and ears on the network. And depending on your network, you would be able to scale it out as much as you'd like to cover hundreds and thousands of these devices on the network. In fact, one of the largest deployment today we have is in a hospital that has more than 20, actually they have 60,000 connected medical devices today on the network. Now, you might be able to plant as many ZingBox hardware appliances on the network as possible to monitor all the connected medical devices. These appliances in turn communicate with the ZingBox cloud so that you are still able to get a centralized inventory management and security for every asset on the network. So you'll be able to leverage a single pane of glass to manage all your 500,000 medical devices.
Very good. Another question. Is the data encrypted when sent from the ZingBox to the ZingBox cloud?
That's a very insightful question, and yes, it is. In fact, the fact that we are currently deployed with several hospitals and patient information is the most sensitive information for hospitals. We go through extreme lengths to take care of the privacy issues around the data that we are transferring to the ZingBox cloud. It is encrypted. The communication between the ZingBox appliance that is deployed on premises and the ZingBox cloud is completely encrypted. In fact, the ZingBox appliance is a hardened Linux appliance that is only allowed to communicate with ZingBox cloud in an encrypted fashion. Another option that many of our customers have chosen is to also route the traffic that is being sent to ZingBox cloud to a local SIEM solution, SIEM, a Security Information Event Management System, so that they get to see everything that is leaving the perimeter of their network.
Very good. The next question, which kind of switches need to be used? How many switches are usually required to equip in a hospital that can have several subnets, for instance?
Great question. Depending on the topology, it really depends. The answer is it really depends. What we do prefer is deploying ZingBox appliance by the aggregation switch. And several subnets can be monitored through a single ZingBox appliance. You really don't have to deploy a different appliance for each subnet on the network. In fact, if we really think about it, today microsegmentation is the only tool that customers have in their toolbox to protect these devices. Customers that we engage with go through extreme lengths to segment their network into multiple VLANs, multiple subnets, so that they can contain an impact of a breach should something happen. However, they really can't protect these devices because there aren't any security tools to secure these devices today. ZingBox can actually identify how many VLAN subnets are your connected medical devices spread across, build out that inventory not only from the device context perspective, but also from a network topology perspective to understand the risk exposure of these devices and what type of devices might it be able to propagate to, should something happen on the network. So to answer that question, we prefer the deployment model wherein the ZingBox is connected to the aggregation switch, or we could also work with any network packet brokers that typically aggregate the network traffic of these devices. So should a hospital have an existing deployment of Gigamon or NetWitness type of network packet brokers, they might simply be able to forward the packets, the connected medical device packets, to ZingBox solution for it to be able to secure those devices.
Very good. Our next question. Is ZingBox considered a network access control tool? It sounds similar to Cisco's network access control product called ISE.
Thank you for that question. In fact, many of the hospitals that we are currently deployed in do use the tools like you mentioned, Cisco's ISE or even tools like ForceScout, Counteract. Now, we are not essentially, we are not like these solutions that you've come across. The reason being, hospitals are actually integrating our solution with Cisco's ISE and ForceScout. The reason being, Cisco's ISE or ForceScout are not able to generate the context of these devices today. They are not able to secure these devices the way ZingBox really does by applying the machine learning algorithm. In fact, in a real deployment that we just had a couple months ago, the customer had ForceScout already deployed in their network. And in fact, they're using ZingBox to feed the intelligence, the context of these devices, and have the ForceScout NAC solution really be the enforcer. So the way we like to think about Cisco's ISE, ForceScout, and ZingBox is that we really are the brains that are leveraging the muscle that is already in place through ForceScout and Cisco's ISE on the network. So we are the brains that can actually leverage existing networking enforcement tools like Cisco's ISE and ForceScout to take actions to secure these medical devices.
Okay, our next question. How does ZingBox discover all the devices on the network? Does it use passive fingerprinting, active scanning, or both?
Wow, wonderful question and very insightful. In fact, I'll really go into the basics here. The ZingBox, when we initially started building out our technology, we were essentially using some active scans. However, what we realized was that IoT devices and connected medical devices really don't respond very well to these active scans, and that's where vulnerability assessment tools practically fail to secure these devices, even understanding the security posture on these devices. So ZingBox solution stopped using active scans. We do not use active scans. What we do is we passively monitor the network traffic from these devices. And the way we detect these devices and recognize them and classify them is through collecting small pieces of information through these network packets. That piece of information can be as small as simply knowing the MAC address of that device, of the network connected device. And it can go as deep as actually doing a protocol level analysis to understand which applications are being used, which protocols are being used, whom the device is communicating with, what is the frequency of that communication, what does the network jitter look like. And what we do is we stitch all of these small pieces of information to create that holistic context of the device. we are not a signature matching technology. So we don't really necessarily believe in fingerprints because fingerprints are often limited to already known knowledge. ZingBox is able to detect devices that we have never encountered in the past in the field in real time because we are a deep learning based technology that automatically puts things together rather than pattern matching technology.
Okay. Our next question from the audience. How does ZingBox handle multiple segmented networks, including vendor proprietary networks?
ZingBox often builds out a deeper understanding of protocols that are heavily used in healthcare industry. What we actually, to give you an example, we spoke about DICOM being used by radiology equipment. There is HL7 that is used by many other devices. There are certain vendor-specific protocols like Cerner and many others. What ZingBox does is the traffic is often unencrypted. And what ZingBox does is we have protocol analyzers that understand the specific protocols, and even vendor-specific protocols can be decoded to build out a complete meaning of these devices. Protocol analysis engine is one of the foundations of ZingBox's technology because we really believe in extracting meaningful information from these communication patterns to build out the context of those devices. And we do recognize that there will be protocols that we have never come across, and what ZingBox does in those scenarios is we have a protocol analysis framework on top of which we quickly build out intelligence of specific protocols that we encounter in the field, even the new ones.
Okay, we have time for one more question. You talked about quarantining medical devices. What does that mean in practice? Will it prevent some specific network communication to or from that quarantine device?
Good question. And I will answer that through a use case that we observed. There was an X-ray machine deployed at one of the hospitals where our solution was implemented. And the X-ray machine was exhibiting some weird communication patterns. Essentially, it was communicating with another IBM workstation on the same VLAN using FTP as a protocol. Now, having deployed ZingBox in so many hospitals so far, we have never seen an X-ray machine exhibit that kind of communication pattern. As soon as ZingBox detected, our machine learning algorithm detected that suspicious activity, even if it was happening inside the network, we raised alarms notifications for the customer. Now, customer can now look at that alarm and say they want to really enforce that policy and block or quarantine that affected device. Quarantining an affected device in an automated fashion is not preferred by customers. So what they typically like to do is look at the communication pattern and surgically block the communications, FTP protocols being used by that X-ray machine to communicate with another IBM workstation on the VLAN. So our policy engine allows the customers to really define or create rather surgical rules to block certain communication patterns and not just quarantine the entire device. We have an ability to quarantine the entire device by programming the switches, the NAC solutions, or the firewalls to which these devices are connected with by creating a dynamic ACL rule and pushing that ACL rule to these network equipment.
Thanks to everyone who submitted questions. Unfortunately, we're out of time. We trust that you found this event educational. Please be sure to complete the evaluation and share your thoughts with us. Today's session will be available on demand until May 8th of this year. Thank you and have a good day.